Live. Wait, okay, and then I'm gonna hit record.
And I believe the recording has started.
Yes, all right,
All
now
right.
you're good.
All right, so I'm going to call to order the Community Health Commission City of Edina meeting virtual on Monday, April 12th, 2021. We already did a roll call for all the members that are present. And we have the approval for the meeting agenda in front of us, if everyone can take a look.
Motion to approve.
Seconded.
Was that Tracy or Amanda?
That was Amanda and then
Amanda.
Philip.
Okay.
Anybody opposed? Lack of silence indicates no one is opposed. Meeting agenda has been approved. And now we'll go for the approval of the meeting minutes from our last meeting, which was March 8th of 2021.
This is Tracy. I move to approve the meeting minutes.
Second.
Okay, we have a second by Greg. Anybody opposed? Silence is nobody opposes, and the last meeting minutes have been approved. Okay, so tonight we'll kind of, unless Jeff has any community comments that came in.
No, 0.
Okay, great. Well, then I guess we will move to reports and recommendations. We first have a presentation about vaccine hesitancy. Are you ready for that?
Yep, I think Atman's on here. He can, he emailed.
Right.
Do you want to kind of give the, do you want to give a kind of a, how we got connected? Or I guess I can. I got copied from the mayor on an email about, hey, I did this study and I'd like to share it. So the mayor sent it to me, so then I connected back with admin about it, and here we are. So we can just, I'll just turn it over to you, see if you can share your screen, and then we'll go from there.
Sure. Okay, it won't let me. The share button is grayed out.
That's not good. Let's see.
Uh-oh.
How can we do this?
It is like that on mine as well, just so you know.
Really?
Yes.
What?
I think when he starts, yep, I think when he starts talking, it would.
Hmm.
Can you see me? This is Mary.
Yes.
Yes, we got
Great.
you.
I was on my computer and I was seeing you and you were not responding, and finally just on my iPad. So I don't know what the deal is. Oh, how frustrating. But I was
Sorry
on the
about
whole
that.
time.
Oh,
Whole time. Approve the minutes. Roll call.
Oh, wait a minute here. How about, let's try this. Presenter. All right, now try it. All right. Just got to pass the ball.
all right.
All right, can you hear me and see this?
Yes.
Yes.
Yep.
All
You're
right,
good.
so I'm Atman Jahagardar. I'm a junior at Edina High School. Thank you so much for giving me the opportunity to present my research, but also to share, the information about my organization with you. Your time is really precious, and I'm super grateful for it. So, Yeah, my research is about the prevalence of vaccine hesitancy and the influencers of COVID-19 vaccine decision in the students, staff, and parents here at Edina High School. And if you want to find this presentation yourself, feel free to go to my website, which is covidedu.org. All right, so I'm not going to spend too much time discussing why this is important, but as we know, COVID-19 is a lethal threat, and these graphs are actually thoroughly outdated, yet even in these graphs alone, 28 million cases were confirmed and 500,000 precious lives had already been lost. So I'm just going to skip over these. I'm sure a great amount of you already know how the vaccine works, but I'm not going to go over the process right now, but there are some bullet points there. But in short, it's really important that you take one if you take Johnson & Johnson, two if you take Moderna or Pfizer to gain immunity against the virus. But so, and they prove to be highly effective. 95% decrease in the risk of catching COVID, and death decreases ninefold. So it's truly a miracle of science. So this was a large phase 3 clinical trial with 43,400 people. Right. So I'm just going to try to get past these things. The Pfizer vaccine is safe. The Moderna vaccine, just comparing and contrasting it. But we're going to go straight to the study. So this was a survey of individuals' perspectives on the COVID-19 vaccine. Its purpose is to learn about individuals' perspectives. I was the investigator. My mentors were a senior scientist at Johns Hopkins, Ms. Donna Roper here at Edina Public Schools, Dr. Houtz, who's my bio teacher. And the survey was distributed, first it was approved by Edina Public School Research Committee. It was distributed to parents, staff, and students, anyone who's 14 years or older, via email in Edina Public Schools. So basically anyone that Edina Public Schools has the email of over the age of 14. It was sent to adults and students. And given a lack of responses from Spanish and Somali speaking families, I contacted the liaisons for the respective languages and got those surveys out at a greater rate to those families, though we did still see a low response rate. And I got 1,544 responses between those two dates. So overall, it was a solid, large study. And so here are the questions. And this happened in January, so it's been a while, and I've done all the analysis, etc. But asked whether they take the vaccine, their age, there are certain demographic sets, such as gender, employment, race, the country that their parents grew up in. And then, so people who said they wouldn't take the vaccine, they were asked why they wouldn't take it, how likely they would be to change their decision regarding that vaccine if they received recommendations from several different groups. Everyone was asked their zip code, and because people who were 18 or younger may have been going to the high school, we couldn't be asking them specific questions. We couldn't ask them like the multiple option questions just because of, I guess, their safety. And that was a decision made by the board and myself. So you'll see some differences, but overall, it's reliable. The data we get is pretty comparative to each other. So the age distribution was set out like this: about half 14 to 18, about half 19 plus in the 1,500 people. The gender distribution was largely female. This may be because the teachers are disproportionately female at Edina. And right, so these are the numbers a lot of people were interested in. And if a safe and effective vaccine is developed for COVID-19, whether they take it or not. 14 to 18 and 19 and older, it looks about the same it is a little bit lower rate of taking the vaccine in individuals 19 and older, but still it's around the same 7.8-ish%. So these were the reasons for vaccine hesitancy. 14 to 18-year-olds are in light orange, and 19 and older are those black bars. The reasons are quite different. So you can see there's just this little box where you guys are, so I'm gonna be moving this once in a while. So you can see that people who are 19 and older would need more information on the safety of the vaccine. They thought their life wouldn't be endangered if they were to catch it, which is ironic, compared to the people who are actually younger and maybe at lower risk. And overall, people tended to think that vaccines may cause these harmful side effects other than autism. People didn't generally think autism would be a problem. Younger individuals thought that long-term data is lacking. There was a general worry about the vaccine's development being rushed. Again, people wouldn't think their life is endangered, etc. So hence, these are the very concerns I'm clearly addressing in interviews of healthcare providers that are being posted on my organization's website, which I will show you shortly. So then we asked them whose recommendations would they follow for vaccination. And again, the responses are somewhat different. In general, individuals 14 to 18 years old are twice as likely to follow a recommendation at all. And this follows, decades of research that say that it's easier to mold people's opinions on certain topics at a younger age, but also it's promising because it may show that younger individuals are less likely to be swayed by their parents on things such as vaccine decision. So healthcare providers, family, and friends were identified as the most influential. But it's interesting how it's the exact same groups throughout, except 14 to 18-year-olds are just, almost 50% of 14 to 18 year olds that wouldn't take the vaccine would have their opinion changed if a healthcare provider convinced them so. So it's just interesting to look at these numbers for sure. And it basically tells us how to solve the problem. So most participants were Caucasians, and 7% of them would not take the vaccine. We'll look at the non-Caucasians on the next slide. So for Asians and Pacific Islanders, there was a solid response. 4 out of 75, or 5.3%, so they wouldn't take the vaccine. After that, the numbers are very low in other demographics. However, soon I'll show how there's still significant information that we can garner from these responses. This low response rate could also show greater rates of vaccine hesitancy. If someone is unwilling to take the vaccine, they're also more likely to be unwilling to take the survey. So for African Americans, it was 33%. For Hispanics or Latinos, 27%. 3 out of 3 Native Americans and Alaskan Natives said yes, and then the other category. So here we looked specifically at the parents' origin and whether they would take the vaccine or not. And so here you can see in the here you can see mostly those response rates. These are just the 5 groups that responded the most. And you may think, like, once we get down below India, where we have Somalia, where we have Mexico, those numbers begin to matter a lot less because of their low response rates. But as we'll see here, if we do a 95% confidence interval, you can see that for individuals whose parents were from Somalia, 95% confidence interval says that 21.5% to 78.5% of them would be hesitant to take the vaccine. And so that means that in the 95th percentile, the 95th percent confidence interval, the lower bound would be 21.5%. And so that is just very significant when you especially compare it to the 1.5% for India or the 5% for the US. It's even 8.2% for individuals whose parents are from Mexico. So we still are able to garner really significant numbers from such a low response rate, while that response rate also tells us about people's hesitancy in the first place. So yeah, so we also asked about employment. 86% were employed. A slightly higher proportion of unemployed would decline the vaccine, but the difference is not statistically significant as the p-value is 0.168, but might be something cool to look into for the future. So the key findings: a survey of 1,500 individuals, about half, 14 to 18, 19 and older. The most common reasons for vaccine hesitancy were needing more information on its safety, its efficacy. Was it rushed? There's this long-term data that, of course, we're going to lack because this is a recent pandemic and a recent vaccine. A lack of concern about the seriousness of COVID-19 infection. Again, interestingly, greater amount of that problem in older groups, and mistrust in the government and pharmaceutical industry. But how do we solve this, right? It's those influential sources of vaccine recommendation, which I found to be healthcare providers, family or friends, educational institutions. 14 to 18-year-olds were significantly more likely to change their opinion based on recommendations at all. And non-Asian minorities are very underrepresented because of low representation, yet seem to show that high prevalence of vaccine hesitancy. And so that's a very telling facet of this study. So its limitations, of course, it was voluntary. I'm not forcing anyone to take this survey. It's predominantly Caucasian because of the demographics of Edina, employed female participants, teachers. I didn't show you the data about what jobs people have, but that was also something I collected. There's this general underrepresentation of ethnic and racial minorities. This could be because of a language barrier, because of these cultural beliefs many groups hold. A lot of them are largely, for example, linguistic based. They're not going to read things as much as they are going to pick up the phone. In access of technology, there's a clear relationship between different ethnic groups and their access to technology because of economic relationships and faith in the government. If you're not from here, you're less likely to trust the institution that's giving you this vaccine. And so these demographic questions, we couldn't ask demographic questions to 14 to 18-year-olds because otherwise we need parental consent. And if your parents are vaccine hesitant, they're not going to let you take the survey, which is a big problem. Right, so where am I going from here? So I founded the Global COVID Guide. The link is covidedu.org, so it's very convenient, and it's based in solving this problem that we just listed. So essentially I have, I'll just show you. So there's an abundance of COVID information in 8 languages so far. I've conducted several interviews in several languages because of several barriers, and show you. So let me know if you can see this. Can you see this?
Yes.
All right.
Yep.
So at the top, we got the Global COVID Guide, covidedu.org. The news strip got top stories, essentially things that may convince people to take the vaccine. The first American to vaccinate was urging people to take the vaccine. All living presidents, including Donald Trump, recommended vaccination. Then there's the select a language, these pretty collection of boxes. And so
That's nice.
we can start with English. This was an interview so I'll start here. There's COVID news. This is in every language for those news stories that I just mentioned. They're in every language, including Ethiopian languages such as Amharic or Kiswahili. And so you can find the vaccine near you. There's information on the pandemic, how it spreads, the symptoms, how to protect yourself from it, information on the vaccine, how to test for it, a vaccine video specific to Minnesota. And so this was an interview that I was really fortunate to be able to conduct with Dr. Nyan Pie and his family. And he went through an year-long battle with COVID-19 where he actually had to be placed on an artificial lung and heart machine to narrowly survive. So we discuss that, but we also talk about COVID symptoms and the COVID-19 vaccine because he is a doctor. So is his wife. And so this, for example, would be what's on the English page. Find a vaccine near you. We've got the vaccine spotter there, the COVID-19 pandemic, how it spreads. It's just a pretty, self-proclaimed, I guess. It's a really beautiful page. And then we can check out all these different languages. I'm not going to go through all of them, but for example, Spanish, I conducted this interview in Spanish with this doctor, Dr. Andre Wernick, and all this information has been checked by fluent Spanish, for example, speakers. Somali is a very important one. And by the way, this news tab is in Somali, if you get to click that. And this is an interview with Dr. Mohammed Hagi Aden. I'll actually play this. Probably should have played these. Can you hear this?
aniga waxaa la yidhaahdaa dhakhtar maxamed xaaji aadan waxaan ahay dhakhtar ku takhasusay cudurrada gudaha internet.
There is a severe lack of COVID information in non-English languages. And so this is one of the first comprehensible interviews in Somali, which is really important, especially to demographics in Minnesota. And so if we just take a look, I'm uploading the Mandarin interview today, and there is so much good work here that really has to be shown. So to break the fourth wall, I guess, the reason I'd be here presenting this is because this is a website which hasn't gained much publicity yet, despite its convenient domain. It's a pretty new website, but it does contain worlds of information that are just very important to battling vaccine hesitancy, not only for COVID, but for diseases in the future. And so, yeah, I can play a little bit of this English clip too. I think this is an amazing interview. You're about to hear a shocking yet inspirational story about Dr. Nayeon Pye, who bravely fought and miraculously survived an over 100-day battle in intensive care with COVID-19, a large part of which included being fully supported by an artificial heart, lungs, and kidneys. Hi, Dr. Pye. First of all, congratulations to you and your family on a successful fight against this disease.
Thank you very much. Thank you that I gave me a chance to share my story.
I'll just skip to the end. Dr. Pye, I know it was a little for me. I cannot thank you enough. Do you have any last words for our viewers?
We want to let everyone to aware that this is a major life-threatening pandemic, and very important facts are that social distancing, wear your mask, wash your hands frequently, and then the most importantly, take the vaccine. We don't want anybody to go through what we went through.
Thank you so much. Things like these. And that's all I have at the moment. The study results are also up here, this presentation, including the key findings. And then this is about the team. Thank you.
Atman, that was
wow.
wonderful.
Wow. It's amazing.
Atman, you may find it useful. One of the key findings that you had was people were concerned, and this is a common finding, that the vaccine was somehow rushed. If you look in today's New York Times, there's an article about Kati Kariko, who was the woman who for 25 years has struggled against all odds, lack of support, lack of belief, to create the mRNA technology that ultimately led to the Pfizer and Moderna vaccines. And you might find it useful because what it indicates is it's been a quarter of a century in building the necessary science to create these vaccines. It's far from rushed.
Right. I mean, it's been worked on for 50 years, and just when we need it most, we're ready. Right. Thank you.
I'd like to offer some thoughts because you did mention that there may have been some issues about how the vaccine may be affecting people with autism. Needless to say, I'm an autistic adult, and so this is my specialty. There is one matter that may need to be done a little research, and that is how the vaccine may affect an autistic's sensory processing. Um, Interestingly enough, I had my first shot a couple weeks ago, and while I didn't really get sick from it, I did have a day last week when I wasn't really sick, but I didn't feel quite like me. And then yesterday was particularly a difficult day sensory wise. Now, there's one thing I want to add to this as far as the background of this. Personal experience of my own with a different medicine. A couple of years ago, I had carpal tunnel surgery, and the surgeon prescribed a narcotic painkiller. And after I was taking it for a couple of days, my anxiety went right through the roof, just went wacko. And so I was thinking that maybe the narcotic had messed with my anxiety medication. Well, a month after that, I went to see my psychiatrist, who is very knowledgeable about autism and how medicines interact. And he explained to me that no, the narcotic painkiller was not affecting my mental health medication, but rather that my autism was actually making the medication work paradoxically. So that instead of calming me down, the autism was interacting with the medicine to rile me up. So those are things that can happen. While there's nothing that's been heard of, but I actually intend to at some point ask my own psychiatrist if there's anything about how it may be affecting some of our sensory processing. So while there's no data yet to talk about whether or not it's affecting autistic people, there may be some yet to come that we may or may not hear about. So I just wanted to add that to what you said.
That's a super important facet of research that it's critical that is and it's conducted and that awareness is spread about. It's honestly a highly neglected group in several ways. So
I agree.
I thought it was really interesting. This is Julia. I thought it was really interesting that, your information, even though some of the populations are smaller, definitely have some of the same issues that we in, larger public health have with vaccine hesitancy and how to reach specific populations and demographics.
thank you. That was one of my favorite things that I garnered from the study.
I thought it was interesting, like one of the first questions was, if a safe and effective vaccine is developed, would you take it? And you still had the people that would say, no, I need to know more. And I thought at first when you showed the question, I thought, well, that's a leading question. Like, if it's safe and effective, well, yeah, then, but you still had people saying, no, I won't. It's almost like, I won't believe you that it's safe and effective. I need more information. So I wonder if you just ask, like, would you take the vaccine if it was available to you, if the results would be almost, I don't want to say worse, but if there would have been a higher number. I don't know. I just thought that was interesting.
Right. It's rooted in, who says it's effective, right? And that is rooted in mistrust in the government and the pharmaceutical industry.
Right.
The other interesting thing I thought was when you were showing you had a graphic with a whole bunch of different bars, orange and black, and it was like 14 to 18 and then 18 and up or 19 and up. And there was a social media at the bottom. It seemed like older people were more likely to rely on social media than younger people. I thought that was really interesting. I mean, it was only like a percent or two difference, but I still thought that was really interesting because I think there's this kind of, thought that, older people aren't on social media as much. I thought it was interesting.
Right. And maybe they may not be on social media as much, but that also may mean that they understand less on average about where that information is coming from.
Mhm. Exactly. Well, thank you. Are there any other,
Yeah,
Tracy?
actually, so Julia, it's Tracy. I'm kind of wondering, because I know, in Ramsey County, we always concern ourselves, the work that I'm doing, with the different populations and the different, especially the translated site that you already have. It seems to me like that's, like you were saying, Atman, that's a really valuable resource. And how do we help you get that into the hands of the people that really need that information? And I'm not sure I have the answer, but it seems like, I mean, is this something that, with Bloomington and Richfield, we should share this with them? Because there's got to be, I don't know. And maybe Julia, with what you're doing in Hennepin County, I just don't know. But it just seems like this is always a problem that we struggle with.
Along those lines, one of the things that occurred to me, Atman, was we do have local papers, the Sun Current and its affiliated papers. Their headquarters are in Eden Prairie, and I would encourage you to contact them. One of their reporters would take an interest in what you have, and I could see them putting out a story in their weekly or biweekly newspaper, and maybe that would get at least to some of the population.
Right. Yeah. I think my advisor sent a story tip to Sun Current recently, so maybe that's something we can be looking forward to. Yeah.
Good. Maybe even the Star Tribune and Pioneer Press. This is very impressive stuff.
Thank you.
Yeah, I would echo what Greg's saying. I think the one issue, Tracy, about trying to get it on some other larger websites like a Hennepin County or MDH is that all of that information and even the links have to be, there's a bunch of accessibility requirements, and I am not the communications accessibility know-it-all, if you will. So that could be a barrier, but I definitely think that reaching out and getting some other people involved is a good idea.
Yeah, I would definitely be willing to go through whatever protocol they may have to make this especially accessible and something they can put on their website.
Yeah, I think we can share it amongst, I mean, just this group of people and the networks that you all have and we all have, that awareness is just out there even more now. So I think I know I can share this with my staff, and when we get calls about different things, if someone wants to see it in a different language, I'll tell them, just send them here. That'll be great.
Yeah, and I'm happy to pass it along through the Hennepin County side too. So
Right, thank you.
And that's a good idea. And I can talk to the communications people at Ramsey County and see what they say. So
that would be amazing. Yeah. Yeah, I'm willing to go through any protocol, of course, to really spread this information. All right.
Great.
Thanks very much.
Thank you so much. This is really impressive. Great job.
Thank you for letting me present.
Thanks for presenting.
All right, I'm going to try to move the presenter thing back to me. Hey, it worked. Okay, then go back to the agenda. And we basically were just going to go to the committees, subcommittees, and the opioid group sent me a kind of a summary, so I'll put that up and they can take it away. I don't know if is that Mary or Greg?
Well, I'll start. And we did have a meeting and began a review of some of the available information at county and city sites. And Mary did the heavy lifting on that, and we'll report briefly on that. In the meantime, I was able to confirm that all of the Edina emergency response personnel, fire, police, and EMTs do carry Narcan. So on the salvage side of the opioid crisis, we seem to be well trained and well prepared. So we thought it would be important to work on the prevention side, which from the standpoint of a local community is a daunting task. But we thought that there were some things that we could do to maybe improve what's being done in Edina. And I'll turn it over to Mary at this point. Did we lose Mary?
Charged. Can you hear me? Can you
There
hear
you
me?
are.
You can now.
Oh,
Yeah.
sorry.
Oh, there you are.
Can you can hear me now, or could you hear me with my little introduction there or not?
No, start over.
Okay, great. This is Mary Absalon, and I'm the newest member on the Edina Health Commission. And I volunteered to be on the opioid work group, where we had our recent gathering. And what we are really charged to do is to try to see what we could do about at least it's my understanding, the rising deaths of opioids. So we really are looking at this as more of right now as an information gathering. And so what this summary is just very high level what we did, and all this information is available. And so in this, we started high level. There's an excellent framework that Hennepin County published. It's called the Strategic Framework Related to, in 2020, Addressing Opioids. And what we were looking at with our information was, what could the city of Edina do to address opioid misuse or overdose death increase? And we welcome people to comment on at least some of this initial information. So we looked at this very detailed strategic framework and wanted to share with you that some high level data that the number of deaths have increased in 2007 from 63 to 2000, and then in 2018 that number of deaths went up to 129, and that's according to the data that was reported that they were able to then to identify. So we wanted to put that out there that yes, it's a public health problem. And so then looking at primary prevention area within that framework was identified as the most reasonable way to see how we could address this challenging area, and through primary prevention to reduce opioid misuse. And one of the things we talked about was just having us all learn how to spell the word opioid. It has 2 I's in it, as well as overdose. And that includes the whole area of safe storage and disposal of medications. And so within that, there are, Hennepin County has information related to disposal, the law enforcement does, and then there are also actions related to prevention of painkiller abuse. So there were some kind of key resource areas related to primary prevention. And then what we did was to just go on to all of the different, several city websites, and we have those identified. We checked actually 1, 2, 3, 4, 5, 6, 7 of our neighboring cities, as well as ourselves. And the most robust website was the city of Plymouth. all of the cities had some link to either the primarily Hennepin County or else their own website related to disposal. And Plymouth had this additional information related to kind of a really neat link related to the prevention of prescription painkiller abuse as well as law enforcement. And so that was one kind of obvious, if we were going to just look at even enhancing our website. And then the other area that we preliminarily identified was the getting rid of opioids, I mean, disposing of them, and that they're included in the Hennepin County strategic framework is some grant dollars. And so we weren't sure about that, but we did identify that the access of where to dispose of medications could be expanded potentially as an area. And we thought maybe that might be a place where the city could do some work. It seemed to be pretty kind of far, it's like this is how you dispose of it, but the actual doing it, making it easy day to day, that kind of thing seemed to be more challenging. So that's just our preliminary first brush at this. And Greg, do you have anything else that we maybe talked about that I might have forgotten?
Yes.
Hello?
Cities.
Say that again.
As we went through these various city websites, what we discovered is that we really had to be looking for this information, and it wasn't always easy to find. Entering the word opioid sometimes brought nothing, but then entering the word drug brought up something. And the Edina site was not particularly helpful in that regard. So one of the things that we talked about was, as we develop some information and maybe some recommendations, that the availability of the information needs to be more obvious. When people go to the website, even if they're not specifically looking for it, they should somehow have it be brought to their attention, because many people may be looking for one thing and then be struck by knowing that they have a son or a spouse or a friend who's struggling with opioid addiction, and maybe we can drive the information from the website out to the public more. Right now, the only people who are going to find any of this information, like Mary, who specifically went looking for it.
And the websites are real different. Some have more of like you going through law enforcement. Some was more just disposal of medications. And so that was just interesting. And then some websites, they just really didn't have a lot. I think it was like the city of Robbinsdale. We even went up there, there was nothing on that website. These cities did have something on there. So there you go. Thank you. Any questions, thoughts?
Thank you for that update. Any questions, comments from anybody?
I think the website review is good, because I think you're totally right on. You have to look for it to find it. I know for us, our police department has the what are they called? The bags where you can put the pills in and then put water in. But I don't know that that's advertised or marketed or anything like that. People basically come in with their bag of pills and they say, "Hey, I hear law enforcement takes these." And then we say, "No, but you can take 6 of these bags and bring them home and put your, 1,500 pills or whatever that you have in these bags." So
that happened to me. I was that person.
Yeah.
I mean, it wasn't it doesn't matter what they are, but when people pass away, you're like, I don't know what to do with this medication.
Yeah.
And yeah.
So that's a good point. That's something that could be better. It could be a more something that gets in people's way a little more often than someone having to search it out.
Is the recycling receptacle still in Southdale Library?
Yes.
Okay. The Southdale Library had a recycling receptacle for those things. I'm wondering if it's still there.
It's sort of ironic that if you wanted to place a site as far from the majority of people in Edina as possible, that's the building you'd put it in. It's as far from residential areas in Edina as any place in the city. So those are the sorts of things we were struck by, and in our conversation we realized that this is a massive international problem, and the things that we can do at the local level probably have to be these relatively focused, if you will, in quotation marks, little things that a community can do to make incremental progress while the whole world struggles with the bigger issues.
I think one of the key messages is that disposal of these medications that are unused is an effective way to address misuse of opioids. And what we find is that it's not such an easy thing to, you're not supposed to flush them down the toilet like was done years ago. So that means that people have to go far away. It's not at the grocery store. It's not at their local pharmacy. Where do they go? That kind of thing. And then even if you go on the website to say, now, where do I go? Are there any new places? Even that was hard. So and people are really overwhelmed with information anyway. So that was one of the takeaways that we had was, is there a way that we could really look at just making this easier to do in our day to day? Oh, I'm going to the grocery store. Can I just dump them someplace or something, or
I
at a
think
farm?
part of this issue is that how widespread is the information about not disposing medicines into the water? Because there's a lot of people who simply don't listen to government stuff. They just don't listen to that. Okay, so and then how are people supposed to know if they're not paying attention? So I have to wonder how widespread is the information about not dumping meds into the toilet and flushing them. How widespread is that information, and what can be done to increase that amount of information so people know?
That's a good point. If you did, then where do you go? It's hard to get to these places. It's like, I'm not going to do that. I'm just going to throw them down the toilet. If they even do that.
Any other questions, comments about that one? I guess we could just see if there's any other, or Julia, you're back. I thought you had to step away for a second there.
No, I just get, kids walking in the background. What can I say?
No, I was just going to
Apparently,
say,
Jenga is the game of the choice tonight. See, and
there you go.
Just what can I say?
I was just going to say, I don't know if there's any other updates from either of the other groups.
There is not really an update from Work Group 1. We had been emailing earlier this week, and I think that emailing will kind of continue for our group for a little while and probably meet up in 3 weeks, first beginning of May, to go over more stuff. And that's the social connectedness group. I think the housing group was group 2. Does that sound smoke-free housing? I don't know if that group has anything they'd like to mention.
We met with Jeff today just to kind of solidify like our end project. So we got that cleared up and we'll begin working on that in the coming weeks.
Great. Are there any other Member comments about anything? No? Okay. Staff comments?
Not really. The vaccine push continues. My group, my staff at the city are, pitching in with the clinics at Bloomington Civic Plaza, and that that those clinics have kind of ramped up to about 2,000 doses a week now. They were at about 1,000 doses a week now, or previously, and they're still targeting kind of the gaps in the other clinics that are being put on by pharmacies and healthcare providers. And now there's going to be a new FEMA site at the St. Paul or at the fairgrounds opening. I think soft open is tomorrow. Main opening is Wednesday. And then you've all seen there's just lots of places to get vaccinated. So the focus of the public health clinics is still that kind of filling in those gaps. And it's interesting to see the different languages required in Ottman's information, because that's one of the barriers to vaccination. So trying to get get people in the door and get the vaccine, or get the vaccine out to them. So the idea of mobile clinics is still happening. There was an event at Dar al Farouk Mosque in Bloomington on Friday of last week. So I have not heard how it went, if it was smooth or if we had some hiccups with logistics or anything. So that was kind of the test, the pilot, and we'll see if there's other areas around Edina or Richfield or Bloomington that the mobile clinics will get set up. So that's where we are with vaccine. I'm trying to think if there's other things going on with the city that are not COVID related to share with you all. I mean, it's spring and there are no leaves on the trees, so people are home and they can see everything in their neighborhood. So my office also deals with neighborhood nuisance complaints, and so those are picking up because everything is highly visible right now. So this is a busy time for that. So that stuff is happening too, and in between COVID questions and that type of thing. So I think that's what I have, unless anyone has questions about that or things they're wondering about that's going on with the city.
Jeff, so that FEMA site, I haven't memorized all. I know they're targeting specific zip codes.
Yep.
I have not memorized those zip codes. Are any of those in the city of Edina?
We have one. So the zip code that we call it the President's Street, northwest corner of town, the zip code that comes out of Hopkins and kind of down to, I think it's where the cemetery is up there. That cross street, it's like Maloney or Mahoney, and then the houses to the north in the Monroe, Adams, Washington, in those streets, those are in that zip code. And they're using a social vulnerability index score to have a list of zip codes. I'm glad you brought that up. So, but the rest of the city is not in those. Our zip codes are not in that. They didn't meet the criteria. The interesting part is there's 2 in Bloomington, and all of Richfield is in that meets the criteria. So our partners in Richfield and Bloomington will be heavily involved in trying to push people to get to that site in St. Paul, or they're actually offering mobile stuff too to come to cities from the FEMA site. So there's going to be a lot of discussion about that. I was thinking for our section there, we're talking about maybe we do mailers, like just direct send letters to every house in that zip code, or every residence, because it's not that many. And then actually I was going to try to talk to Hennepin County and see if there's some kind of event that happens, in Hopkins or something, to, can we can those folks dovetail into that too? So, but that's how we're interacting with that effort.
Yeah, we can talk offline about the Hennepin County because I'm adjacent. I've backed off a little bit. But yeah, we can chat, or at least you know who to call. So
Yep.
yeah, because it's interesting. I mean, I understood the index and all of that stuff. I didn't quite know if we were part of it or not. So
Yeah, they're going to do 3,000 a day.
yeah, which is what some people can do in a week.
Yeah. So one with that site going and the Mall of America site going, I mean, it's the capacity is getting better. So
yeah,
Great.
So, Jeff, I had a question. Has there been any talk of reopening City Hall?
it is being discussed, kind of how we would do it, you know, what protocols, you know, still the main thing is the governor's, you know, emergency declaration. That's why we can have virtual meetings. You know, if that goes away, we have to meet in person. So that's a big shift. There are people that are wanting to start to meet in person. It's not been something that's really been pushed a lot. We're really not getting a lot of requests from residents. Like maybe I said this last time, but the most frequent request is when someone wants to do homesteading paperwork. They want to come in person and get help with it. But that has just not been very frequent. And otherwise, almost everything that we're doing has been being done online. So it's been fine. We've really not had that, you know, demand for, you know, reopen the building. I guess meeting space is an issue, but most people are meeting virtually anyway. So we're not having the athletic associations meeting in the mayor's conference room and things like that. And that's probably fine. So it's being talked about, but it's not being pushed, I would say.
Thanks.
yeah, because once you start opening it up, you have to still be able to socially distance and all of those other things because you can't really, it becomes a whole thing asking people, are you vaccinated? You can't really ask people their private health information. So it becomes a little tricky. Any other staff comments, Jeff? Anything else going on?
No, just the mention of City Hall there, the next time, whenever it is, the next time you go in there, you will notice it's different because the remodel of the front, like security, is done. And the front desk where Lynette, who's the front desk person, she runs that up there, that has been changed and expanded to be larger. And then there are now plexiglass walls and like swipe in badge points on the first floor and the second floor to get back to where the staff are. So you can, on the first floor, you can go into the restrooms on the left, if you remember where they are. There's like the council chambers, then there's restrooms, and then I think you can go to Park and Rec because that's a frequent in and out. But after that, you have to badge in to get back to like building inspection, planning and zoning, any of that stuff. And then on the second floor, when you go up the steps, you remember there's a landing up there, and then you kind of turn left and go down the hall. But before you get to the hallway, there's a plexiglass wall with a badge in. So you can't even get to the restrooms upstairs without badging in. So so it's a big shift. So that'll be quite different the next time you go in. So, but that's pretty much complete, I believe. So it was actually good timing to get that done because no one was around. So it was less disruptive. But I think that's all I've got.
Yeah,
Okay.
now there's a concern that the cases in Hennepin County are increasing.
Mm-hmm.
Yes, they are.
Yeah.
And yep.
Yeah, because my parish, the Episcopal Cathedral, is closing the building again because they were starting to take small groups in, but they're going to stop doing that because of where the count is in Hennepin County at this time. Until that count comes down, they're not going to have anyone in the church. So
Yeah, I think the count last week was in the mid-30s. I don't know. I've lost track at this point. The rolling average, and Edina was above the county average.
Yeah.
But it goes up and down. So
I mean, we're at this place where stuff is people are starting to do more things and be around each other more. But that's also causing cases to rise, even though the vaccine is getting out there more. So we're at this weird place. I just saw an outbreak announcement from the state where like 56 wrestling teams from Minnesota went to South Dakota and had a wrestling tournament, and now there's a huge outbreak. So I don't know.
And there's no data yet as to how well the vaccine is working yet. That there's no data about that, or there's just
when you look at a wrestling team, most of the people on the wrestling team aren't even vaccine eligible anyways.
Right.
Oh, okay.
Because it's
That's youth.
17 or above.
Right.
Or 16 or above for Pfizer. So there's that too.
Yeah.
Sid Hartman would have asked who the geniuses were who thought it'd be a good idea to have a wrestling tournament in South Dakota.
Yeah, that would have been a good quote from Sid.
Right.
Oh. It's a race. It's a race against the variants.
Yep.
Right.
Anything else? Okay. Well, if there's nothing else. Thank you.
Is that what you're looking for?
Yeah, that is exactly what I'm looking for, Amanda.
And I'll second
you
that.
read my mind. All right, and Tracy seconds. I will give 5 seconds to see if anybody objects. Anybody? Okay, I'm taking that silence as there are no objections and the meeting is adjourned. We will meet again on May 10th, correct?
Yep.
Yes.
Yes, and in May, I believe, is when the commission meets with the council.
That was what I thought.
So I will send that out to everybody.
Okay.
All
Great,
right.
thanks.
Have a good
Have
night.
a good evening, everybody. Bye.
Enjoy all.
Bye-bye.
Bye-bye, buddy.
He's been wanting to talk the whole time, so I figured I'd let him.
Hey, let him talk.
But he's going to be very, very loud. So have a good night. I'll talk to you later.
Bye.